Police have caught a thief today at the mansion of Brian Scalabrine, trying to break in and steal one of his most prized possessions, a pair of sneakers called the Nike Enigma. Previously worn by many NBA greats, including Michael Jordan, LeBron James, and Kobe Bryant. I'm Tae Lee, and you're watching CBC News. Just hours ago, the police have caught the burglar outside the millionaire's estate, trying to steal the shoe, which is a value of $300 million. Luckily, the shoe has been returned. Here we have our reporter Mike, who will give us more information on this incident. Mike, are you there? Hello? Thanks, Teddy. During his sneaker heist, he seemed to have obtained an injury to the knee that had caused him to be immobile. The police found him lying on the lawn 2 steps away from the point of entry. However, he's being rushed to the nearest hospital to be treated. Here's the surveillance footage from this morning's robbery outside the millionaire's house. The suspect showed excessive bleeding patterns that simply cannot be stopped at first. After 2 hours of treatment at the hospital, the bleeding has been apparently sustained. Here we have Dr. Zhang, who has successfully treated the suspect. Hello, Dr. Zhang. What is the diagnosis of the suspect?
Well, after applying treatment, we're pretty confident that the suspect is suffering from hemophilia.
Can you give us more information about what is hemophilia?
Well, hemophilia is a genetic disorder that affects blood's ability to clot. There are 3 types of hemophilia. First type is hemophilia A, second type is hemophilia B, and third type is hemophilia C. Although there are also many different types, these 3 are the most common. Hemophilia A is a deficiency of clotting factor 8. Hemophilia B is caused by the deficiency of clotting factor 9. And hemophilia C is caused by deficiency of the clotting factor 11. Hemophilia is an extremely rare disease. The most common type of hemophilia, which is hemophilia A, only occurs in about 1 in every 10,000 births. Male is more likely to have hemophilia than females. Hemophilia lowers the number of blood plasma clotting factors needed for normal blood clotting to occur. When blood vessels are injured, scabs does form temporarily, but the missing coagulation factor prevents fibrins from forming. Therefore, the blood clot is not maintained. A person with hemophilia does not bleed more, but simply bleed longer than a person without hemophilia. Severe hemophilia causes minor injuries to bleed for days or even weeks. In areas such as the brain or inside the joints, this can be fatal and debilitating.
So, doctor, what is the cause of hemophilia?
Well, to answer this question, we have to go back to when the blood vessel is injured. So when blood vessel is injured, the body pulls in blood cells together to form a clot to stop the bleeding. This process is called coagulation. This involves platelets and plasma proteins that encourage clotting. This is called clotting factors. The immediate cause of hemophilia is a deficiency in these clotting factors, causing the blood to not clot. Hemophilia is an inherited disorder. In other words, you're born with hemophilia. It is not contagious and is not infective. Well, everyone has 2 sex chromosomes. Females have 2 X chromosomes. Males have 1 X and 1 Y chromosome. Only X chromosomes carry the gene related to deficiency in the clotting factors. Since the male inherits a Y chromosome from his father and an X chromosome from the mother, while a female inherits X chromosomes from both the mother and the father, a male who inherits the faulty X chromosome or the hemophilic X chromosome from his mother will definitely have hemophilia, while a female who inherits only one X chromosome from either the father or the mother will at best be a hemophilia carrier. It is only when the female inherits two faulty X chromosomes that she will become a hemophilia patient. Therefore, hemophilia is extremely rare. As you can see in this diagram, if the father has one faulty X chromosome and a healthy Y chromosome, while the mother has no faulty chromosomes, their daughter will become mere hemophilia carriers, while their son will have no hemophilia. However, if the father is healthy and do not have any faulty chromosomes, but the mother is a hemophilia carrier, or in other words, have one X chromosome that is faulty, their son has a possibility of being hemophilic because the son might inherit the faulty X chromosomes from the mother, which makes him have hemophilia. Mutation can also cause hemophilia. In this case, the mother of the child may not be a hemophilia carrier, but however, because of some mutation, the child may also have hemophilia. But again, this is very rare. Note here that the gene that causes hemophilia C can be passed on by either parents, the mother and the father. And the child who carry hemophilia C can either be a boy or a girl.
So doctor, what are some symptoms that show you have hemophilia?
Well, two of the most prominent symptoms of hemophilia are excessive bleeding and bleeding in the joints. The extent of the bleeding determines how severe hemophilia is. Mild hemophilia may not be detected until a major wound on the skin or tissue happens and the patient suffers excessive bleeding because of that. Moderate hemophilia may experience prolonged internal bleeding in form of bruises. Severe hemophilia can often bleed for no apparent reason. This is called spontaneous bleeding. This individual may bruise easily, and the bleeding is often hard to control. Bleeding in the knees, elbows, or other joints is another common form of internal bleeding in people who have hemophilia. These bleeding can occur with no obvious injuries, as of the case with our suspect here. Moderate and severe hemophilia often experience this symptom, and this symptom will lead the individual to be immobile because the bleeding in the joints will cause stiffness in the joints and cause immobility. Other common symptoms of hemophilia include large, deep bruises, unexplained bleeding, nosebleeds with no cause, prolonged bleeding, unusual bleeding after immunizations, neck pain, double vision, and overall fatigue. Severe hemophilia patients may also suffer severe internal bleeding and possibly in the brain. Brain bleeding often have symptoms that includes long-lasting painful headaches, repeated vomiting, sleepiness, sudden clumsiness or weakness in the arms, and possibly seizure.
So doctor, how do we diagnose hemophilia?
Well, to diagnose hemophilia, patients go through either a physical exam or a blood testing exam. A blood test is preferred because it measures the time it takes for the blood to clot, whether the blood has low levels of clotting factors, or whether any clotting factors is completely missing from the blood. The test results will show whether you have hemophilia and what type of hemophilia, and the extent of the hemophilia that you have. Mild hemophilia have about 5 to 30% of clotting factors in blood. Moderate hemophilia have about 1 to 5% of clotting factors in blood, while severe hemophilia have less than 1% of clotting factors in the blood. Women who are hemophilia carriers can have their fetus tested for hemophilia. They can also have pre-implantation diagnosis to have children without hemophilia. For this process, the woman will have their egg removed and fertilized by sperm in a laboratory. The fetus are then tested for hemophilia. Only the fetus without the disorder are implanted in the womb.
So doctor, how do you treat hemophilia?
To answer this question, I have an assistant who specializes in the treatment of hemophilia. I introduce to you Dr. John.
The treatment of the hemophilia, there are different ways. The first way I'm going to talk about is replacement therapy. The clotting factor 8 for A and clotting factor 9 for B are injected into the vein. These infusions replace the clotting factors that are missing. The concentrate can be made from human blood. The treatment is to prevent the spread of hemophilia. The treatment can be used on a regular basis, which is called preventive therapy, or to stop it instantly, called demand therapy. There's another way to treat hemophilia, which is by demopressin, which is a man-made hormone used to treat people who have mild hemophilia patterns. There's also another way, which is called antibrinolytic medicine, which are pills which help keep the blood clots from breaking down. Gene therapy is another way, but it has yet to be developed to be accepted. So doctor, what is the recovery process for hemophilia?
Well, the prognosis for hemophilia is not really possible because hemophilia is a genetic disorder that cannot be cured with this level of technology. However, with the advancement of technology, a near normal life can be achieved with hemophilia patients. Adequate treatment can generally reduce the risk of life-threatening bleeding episodes and joint bleedings. It can also alleviate the effects of hemophilia. As introduced by my assistant, Mr. John, the use of clotting factor products can lead to a near normal life. Life stage changes can also help to reduce the effects of hemophilia. For example, exercising regularly can build up muscles while protecting joints. Avoiding certain medications, such as aspirin, can help to stop the excessive bleeding, and practicing good dental hygiene so to prevent gum bleeding that would trigger the excessive bleeding of hemophilia. And as mentioned by Mr. John, gene therapy also holds future promises of curing hemophilia. Hemophilia patients also have to avoid injuries. Because of the extent of the bleeding brought by hemophilia, hemophilia patients can often suffer severe infections that will cause other problems associated with hemophilia. Therefore, it is important for hemophilia patients to protect themselves and avoid any possible injuries.
Thank you for your time, doctor.
No problem, and thank you for having me.
Well, thank you for tuning in. See you tonight at 11.